domsa bhean seo a nucht agus gohagam a céad mí fáile a gohála ceachtain an seo. Good evening everybody. For anyone who doesn't know me, I'm Mary Butler. I'm a TD from Waterford and I am the Minister of State for Mental Health. And believe it or not, I've broken all records because I'm the Minister for this is my 6th year in a row, having been reappointed on 3 occasions to mental health, and it's a role that I really enjoy. I'm delighted to be here tonight at the invite of Carlow Mental Health Association. A couple of weeks ago, maybe longer, I got a text from my good friend and colleague, Minister Jennifer Moran O'Connor, and Jennifer said, save the date, Mary, Friday night, the 10th of the 10th, and I said, you know, that's World Mental Health Day, so what a fitting night to be here. And she said, you sure now you'll be able to come? And I said, I guarantee you, once Jennifer asks, you do not refuse. It's as simple as that. Also delighted to be joined by Cathaoirleach of Carlow County Council, Councillor Ken Moran, my good friend and colleague, Councillor Fintan Phelan, Councillor Fergal Brown, and Councillor Ben Ward is here also. Delighted to be joined here tonight by Superintendent Anthony Farrell and many Gardaí that are here tonight that play such an important role in relation to community initiatives, supporting people through difficult times and good times. So I really would like to thank you for being here tonight. It's really important. I also want to thank the sponsor, Michael Quinn, and for all the community organisations that came together in order that there would be an elephant in the room. Lynette, I just want to thank you for your leadership for Carlow Mental Health Association. When I walked in and I saw all the lovely yellow hoodies and the yellow t-shirts, you're an amazing organisation. The way that every year you think of something new, and I've met you on several occasions, and it's absolutely great to be here. I want to start off by talking a little bit about Brent Pope. So, for many of you who don't know Brent Pope, he's a famous rugby player, he's a Kiwi, he comes from New Zealand, and I have worked on a few occasions with Brent in relation to the elephant in the room. So, on World Mental Health Day, and I say this every day of the week, there is no health without mental health. There is no health without having that peace of mind. There is no health when your emotional well-being is upset. And Brent Pope, somebody that we all know and love from the rugby world, he was the big burly man that was able to say, I'm just not there at the moment, there's something wrong with my mental health. And he came up with this idea of a physical elephant in the room. And the first time I met Brent was down in Waterford about 18 months ago when they unveiled an elephant. And a few of the businesses came together, and the elephant has been travelling around Waterford to different businesses every month. Before I left the Department of Health last year, I decided that I'm going to put an elephant in the Department of Health. So Jennifer knows it well, so when you're a minister in the Department of Health, you work in a facility called Museum Plaza. There's a few different departments there, the Department of Children are there as well. Hundreds and hundreds of people working in the Department of Health, and I said, what a more fitting place could there be an elephant, and that when people pass by in the morning, they look at the elephant, it might resonate with someone that I'm not having a good day and it's really important to have the conversation. So my elephant, Cara, I called her Cara, the Irish for friend, was unveiled just before the general election last year, and I didn't think I'd be seeing Cara again. But I did see Cara again when the Taoiseach reappointed me as Minister of State Mental Health and also Government Chief Whip. So a busy woman, a TD from Waterford, a mammy as well, and busy lives. But that's the importance of having, I can't wait to hear what the name of the elephant is, but that's why it's so important to have an elephant, so that we're all very much aware of the challenges we face every day of the week. No health without mental health. So we have a problem in Ireland in trying to get men to reach out and ask for help. So unfortunately, 4 out of every 5 suicides in Ireland are male. Today in Ireland, we offered hundreds and thousands of counselling sessions and 75% of every counselling session that was availed of today were by women. 1/4 were availed of by men. So we're just finding it very, very hard to get men to say, I'm not quite right, there's something wrong, I'm out of kilter, one of my favourite terms, and it could be in relation to your living arrangements, it could be in relation to your relationship with your partner, it could be something happening in work, it could be financial issues. We don't know, but 2 out of every 5 people in this room at some stage will be challenged with their mental health. A lot of us are challenged with our emotional well-being. There is a difference, because your emotional well-being can be upset, you can suffer, low mood, anxiety, maybe depression. And then there's the people who have enduring mental health conditions, who live with an enduring mental health condition, who needs the support of mental health community teams, maybe the Department of Psychiatry. We have people who are involuntary detained, who are voluntary detained, and those people find it tough. And there is a stigma associated with mental health, and we have done a huge amount to reduce that stigma. But the stigma around people with enduring mental health conditions still remains. So every single night that we are out talking about mental health is really, really positive. On the 1st of September this year, so just 5-6 weeks ago, I launched a new initiative, 15,000 free counselling hours for men. So you just log on to yourmentalhealth.ie/men. And there's 15,000 free counselling hours. I secured the money in this year's budget, 2025, not the budget that just went this week. And I spent a lot of time over the summer working on it. So I've partnered with Exchange House. Exchange House are an organisation in Dublin that support the traveller community. And I was able to fund a 24/7 call line for them, appropriate counselling for the traveller community. I also worked with one OME, the Retired Veterans Association, so Army, Navy, Gardaí. You can be a retired veteran, believe it or not, at 28 or 26. You can be in the Navy or in the Army for 6 or 7 years. You don't have to be in your 50s or your 60s to be a retired veteran. A lot of those people struggle. I was able to support a call line that was already in place, but they were struggling, they didn't have the funding, was able to give them money to expand it out. Working with the Irish Farmers Association, for example. So you take an average farmer working all day, out milking the cows in the morning, comes in the evening, back out milking the cows. Is that person going to hop in the shower, change their clothes, drive into the nearest town, whether it is Carlow, whether it is Waterford or Dungarvan, wherever, and go into a kind of a medical setting and ask for counselling? No, they're absolutely not. So I have partnered with Connect Counselling, an organisation that are providing free counselling in our hours from 5 in the evening until 9 at night, 7 days a week. So you can pick up that phone and you can talk to these counsellors from your kitchen table, from your sitting room, from your bedroom. And I think that's really important for reaching out to men. I've also partnered with My Mind. My Mind are a phenomenal organisation that I'm very, very fond of. And they provide supports, counselling supports, at a very low cost normally, but these ones are free, in 20 different languages. So you take somebody who's after coming in from another country, they're living here, they're after coming in on a permit, they're working on a farm, they might be working kind of in isolation, working in a shop, working anywhere. And they might be feeling alone, or they might be feeling really, really challenged. So there's 5,000 hours of counselling between this and Christmas, and I want people to take it up. The GPs are aware of all these counselling sessions that we have in place. The GPs meet online every month. So in September, 1,200 GPs logged on, and some of those that work in the Department of Health with me came onto the call with them, and they explained to them all of these free counselling hours that are there for men. Because the women are already taken up the support, the men aren't. And already we have a solid uptake, which is really, really important. And that's the most important thing, that people are talking about their mental health. We are going to run an advertising campaign in the local radios very, very shortly. It's kicking off. I'll be encouraging through Minister Jennifer O'Connor that we're going to partner on this, getting out to the men's sheds. We want to get the message into all the Garda stations around the country for them to know that there is counselling there. And the one thing I want to say about the Connect Counselling, please, you just log on to yourmentalhealth.ie/men, and you don't have to be referred by a doctor. You can have up to 6 counselling calls, and then if you still feel you need to meet someone face to face, that's there. This is ring-fence money, it's not going anywhere else, there is no waiting list. And it's a really important initiative, and I'm proud of it, I'll be honest, because all the work I do in relation to mental health is lived experience, my own lived experience. I have no clinician's background, but I've been around the block, you know, and we all have somebody in our family that has suffered and is still suffering. And being able to recognise that and being able to speak about it is really important. Another thing I launched earlier on in the summer, and this is specifically for 14-year-olds to 34-year-olds, money I secured in this year's budget as well, is in relation to the Navigator tool. And the Navigator tool is, so you log on to spunout.ie, you all have heard of Spunout, /Navigator. And it's appropriate content for 14 to 34-year-olds. But the difference with this is there's 3 questions, and you answer the question, and it leads you straight into text about it. And there is somebody on the end of that line that will text you back, and you can have the conversation with them. So there are the 2 key messages I wanted you to take away tonight when you go back out to your communities. The Navigator tool, so spunout.ie /Navigator for the 14 to 34-year-olds. Because the 14 to the 34-year-olds, especially the 14 up to 18, they are dealing with a time of social media when there's inappropriate content, there's misinformation, there's disinformation, and they're absolutely overcome with everything that's being thrown at them. But this is appropriate content, and it was designed by 900 young people through Spunout that came together that I was able to fund. And the other piece is yourmentalhealth.ie /men. I just want to touch on the budget which has just passed this year, which has just passed on Tuesday. It seems like an eternity away. As you all know, anyone in the Fianna Fáil party, we had quite a stressful week, and you have to look after your own mental health as well. And so the budget was on Tuesday, and I was delighted as Minister for Mental Health to secure the biggest budget I ever had for mental health, so 83 million in additional spending for next year. But what that breaks down to is 300 extra staff, 300 full-time equivalents, 300 more people who will be working in mental health. The focus on my budget this year was crisis supports, crisis responses, and suicide prevention. Suicide is a very difficult issue to talk about, and any suicide is one too many. We have families bereaved, we have siblings bereaved, we have communities, we have schools, and the effect it has is absolutely unbelievable. But I have to say, working with the National Office for Suicide Prevention for the last 5 years, we have seen a reduction in the amount of people who have died by suicide in Ireland. So over the last 20 years, we have seen a reduction of 25%. So whereas we were one of the worst in Europe in relation to suicide, we're now number 12 in Europe. So there's 15 countries that are worse than us, and we're number 12. We have made progress. The preliminary figures for suicide for 2023 are 302, and that's 25% lower than the previous year. They will revise upwards as the coroner course report on suicide. But what I'm saying is, I think we're finally starting to make the breakthrough. When you have groups like Carlow's Mental Health Association on the ground, helping people every day of the week, when we partners with the like of PHR, whether it's Choctaw and Kilkenny, or whether it's Spunout, whether it's My Mind, all the various organisations, Jigsaw, when we partner with them and we fund them, they are making a difference on the ground. So the budget will mean that we're taking a crisis response. So for the first time ever, and I had to start with the level 4 hospitals because you can't do everything together. So I'm starting with the level 4 hospitals, so we have 9 of them around the country, and I have secured the funding, 48 posts, to put 4 nurses, so mental health nurses, clinical nurse specialists, advanced nurse practitioners, highly qualified, to go into the emergency departments out of hours. So when the main team has gone home after doing a long day's work at 6 or 7 o'clock in the evening, we will have mental health nurses in the emergency departments to support the non-consultant hospital doctor who's on call, who have to deal with everything. And that means, and I hope and pray, that nobody feels they have to leave the mental health. Nobody feels they have to leave the emergency department because they're sitting there and they're upset and they're worried and they're not being listened to. That's what I'm hearing from people on the ground. That's what I've reacted to. We're also opening more crisis resolution teams, more crisis cafes. I opened a crisis cafe, Solace Cafe we call them. I opened one in Sligo during the summer, and already by then having a crisis cafe, a Solace Cafe in their town, the amount of people going to the emergency department in mental health distress had reduced by 18%. So we know that we have some across the country. They're hard to set up. So where you do manage to set them up, for example, they cost 300,000 a year to run, because they're peer-led, people with lived experience, and some qualified people in relation to mental health. But when you have an organisation like, for example, Carlow Mental Health Association, we were able to stand one up in Galway very easy. We were able to stand one up in Cork very easily because we had those associations behind it. I'm struggling to set one up in Waterford with a couple of years, but we're nearly there. And Aware, for example, are the organisation that are going to provide the supports. But these supports are provided out of hours at a time like 7, 8, 9, 10 o'clock at night when somebody is in distress. Will I or won't I go to the emergency department? Will I go for a walk along the quay? You know, what's next for me? And just know that there might be somebody who is there that would have the conversation with you, that would have the cup of tea, would tell you that it's okay not to be okay and it's okay to ask for help. That's really important. Another few things I'm doing with the mental health budget as well is we had to close beds in Cherry Orchard in Lindara in Dublin a couple of years ago due to save staffing. These were inpatient beds for young people, especially those with eating disorders. I secured the funding to reopen 11 of those beds. I also secured the funding to open beds in the new Children's Hospital. 30 staff to open 10 beds because we'll be transitioning there next year. And I also secured funding for, and I know the superintendent will be very pleased with this piece. We have a national forensic mental health service in Portrane. An awful lot of people who come through the justice system are detained there. They're not voluntarily detained because they've come through the justice system. So this year we're opening 18 new beds there. But starting next year, I secured the funding to commence the ICRO, which is the Intensive Care Rehabilitation Unit. So I secured 30 staff there to open 10 beds. And these people that work in mental health have to be commended because it's not an easy job. They're working at all times of the day and night. They're working with the most vulnerable people in society. They're working at a very, very difficult time for some people. And like they might be challenged themselves. They might have things going on in their own life. And I just want to commend everybody who works across mental health services because it's a tough job, but it's a very rewarding job, and we're really, really lucky to have people working in mental health services across Ireland. It makes such a difference. One small act of kindness can make such a difference. So it's after been a busy week for me and my colleagues. We've put the budget in place. From a mental health perspective, it's the best budget that I've ever delivered in 6 years. And I'm really proud of it, and I'm really proud to be the Minister for Mental Health that was able to do that. We were able to provide more funding for Pieta. Pieta are a fantastic organisation. They have been challenged recently in relation to funding because, as Carlow Mental Health will understand this, it's harder now to, I suppose, fundraise. It's harder since COVID to fundraise. It's harder to bring that additional funding in. And I spoke at length with Pieta, Stephanie Manahan, their manager, their chief exec, and we were able to do some more for Pieta. One of the areas we're also funding this year is post-pension supports. And post-pension supports are people who unfortunately are bereaved by suicide and people who have lost a loved one and who are really finding it hard. We have appropriate counselling supports for travellers who are bereaved, We have that rolled out across the whole country since this year. But the post-vention supports are really, really important for people that are struggling because they're bereaved by suicide. I'm the glass is half full person. I always believe that recovery is possible if you can accept that you need help, if you can reach out and ask for that help. I also believe there is no health without mental health. So during the summer I kind of had a chat with myself, because any politician, for example, so you're a TD first and foremost for your own area. So I'm a TD for Waterford, Jennifer's a TD for Carlow, Kilkenny. I forgot Kilkenny, sorry. And your first and foremost job is that you're a TD. I also have a couple of other jobs as well. I'm the Chief Whip of the government, really, really busy job. I'm the first woman from Waterford ever to sit at the cabinet table. I'm the first person ever to bring mental health to the cabinet table. Imagine now that I get the opportunity to discuss mental health at the cabinet table. That's unheard of. There's very few countries around the world have that. And then coupled with that then, as I said, I'm the Minister for Mental Health. And so there's a lot, you're juggling a lot every day of the week. But for me, the good days are the days that you can deliver a budget. So the most important thing we now do, after getting that vital funding, after getting the 300 staff, the most important thing we do now is that we hire them and we get them working across the communities and delivering all the services that we need. I'll finish on, because once I start talking I forget to stop, and I hope now I'm not after going on for too long, but I'm so passionate about mental health. But I'm going to come back to the elephant in the room. Let's talk. It's so important that we have that conversation. You're walking down the street and you say to someone, "How are you?" And and then you say, "But how are you really?" Because that's the difference. That can make all the difference to that one person that you meet today. And I'm not sure where you're going to place your elephant. You might tell me, whoever, before the end, where the elephant is going to be. But I have to say, wherever the elephant is, that elephant, and Brent Pope, he has to be commended on this fantastic idea. That elephant, whether it's Cara, my elephant, up in the Department of Health, or whether it's this particular elephant that I can't wait to hear the name of, and I can't wait to see it until it's uncovered. Whichever elephant it is, we all have elephants in the room. We all find life difficult on different days. And as I said, I said to myself during the summer, you've only one life, you're only here for a short length of time, and it's about time you got out of the car and you started walking and giving yourself 30 minutes a day. So the new Mary Butler with the last 3 months, and I feel so much better for it, I'm taking 30 minutes a day for myself. I wasn't doing that. You give anybody working in politics, anybody working in community, working in the Gardaí, working in organisations like mental health, because if you're on one committee, you're on 5, and I'm that person. And if you don't take that 30 minutes for yourself, whether it's even to just sit down and watch an episode of EastEnders, or whether it's just to go out the garden, water a few plants, or go for that little walk, so important that we're all kind to ourselves, because life is too short. So thank you very much for honouring me by asking me to speak here tonight. Today is World Mental Health Day. All across the world this year we will lose 800,000 people to suicide who just feel that they can't go on any longer. But please take that message out from here tonight. There is help, please ask for it, and recovery is possible. God really want to be there.
Very much, Minister, and I'm sure there's something we can all take from that.